now I'd like to introduce everyone to Mercedes Gutierrez, who is actually our Vice Chancellor of Human Resources and a consummate presenter. I mean, she has so much information, and I wonder sometimes, where does she hold all of that in her head? But she will be presenting on the different types of leaves of absences that is available to employees in our district. And so with that, I'm going to turn it over to Dr. Gutierrez.
Thank you, everybody, for joining us today. So we have quite a bit of information to share with you, and I know you all had a lot of questions relative to reasonable accommodation, and you can keep asking Nicolas questions. Better for him. Okay, so we wanted to augment the reasonable accommodation process and what it is, obviously, first and foremost, because there's often questions that get tied and linked from reasonable accommodation into FMLA and other leave provisions. Please bear in mind that this is not an all-inclusive presentation. We do have information to share with you. We always want to emphasize that a lot of the information on FMLA is the key big ticket items, but we are here to augment information and here to support ODEI through what is reasonable accommodation, what is FMLA, what is workers' comp. Ross Lee was to co-present with me today, our workers' comp specialist. He's unable to join us, so I will cover that as well and give you some basic information on how accommodations and workers' comp and all of that works relative to our presentation. So I want to begin by letting you know that we have several applicable laws that relate to leaves in general in the state of California. We are a public entity and we are a public education entity, which means that our regulatory requirements come from the California Education Code, they come from Labor Code, they come from state and federal mandates such as FMLA and CIFRA. CIFRA stands for the California Family Rights Act. It is California's version of FMLA, and we'll kind of talk about that in a bit. We also have pregnancy disability leave, which is applicable, obviously, to someone that would be deemed pregnant. And we also have laws that prohibit discrimination based on leave protections, both federal and statutory requirements, in particular, our ADA, which is where we draw from our reasonable accommodation, through FEHA, which is the Fair Employment and Housing Act, which also has an emphasis in the state of California. And we also are bound by workers' comp statutes. So all these leaves in their totality are specific rights that individuals have in this particular organization and in any other public education agency. We are bound by them. There are so many of them. Folks try to understand them all. You can't always get a full understanding because you take from here and you go from there, and then this other law comes up. And while we have statutory requirements, these requirements are always updated for us under the federal regulations as well as state mandates. And so it's always important for us to try to have these conversations with you because laws change. And unfortunately, policies, procedures, and practices sometimes have to get amended, causing people to get very frustrated. But if you'll note in the diagram that I have before you, I just want you to understand that we are bound to follow all these particular statutory requirements. And before I forget, also joining me today is Dr. Annie Reed, who is our interim dean of employee and labor relations. She'll be assisting me as well. And we have a special guest who I usually keep as a well-guarded secret in HR, but Ms. Lisa Biggers, who is our acting director of human resources, and she's doing all things COVID and getting us into compliance with the vaccination policies, which is another piece that we're dealing with. And so they're here joining me today. Okay. And you may hear from them as we go along today. I want to emphasize that even though I just shared with you, various applicable federal and state requirements, I also have to emphasize that your collective bargaining agreements, depending on your rank and file in the organization, also speak to several of these regulatory requirements. And so they are written and embedded in source based on your collective bargaining agreement. And again, we want to emphasize that if you have specific questions on leaves that may be applicable to you, that you look at the appropriate labor agreement. Now, And I want to also emphasize that even if you are not represented by a labor agreement, it does not negate our statutory requirements to provide you leave in a public employment agency. So there are various leave examples in this chart. There are mandatory leaves, which means that under the law in the education code, we have to provide them to you. Under other federal and state requirements, we are obligated to provide them. Now, there are also what are known as permissive or optional, and permissive or optional just means that they're great to have, and if we offer them to you, we can. If there is a labor agreement where we've agreed to it, we can provide it to you. Sometimes it's applicable because of a specific circumstance. It's where we draw upon when we need to have some type of specific leave that is important to the organization, like work-related leave. There's unpaid leave, and these are all types of opportunities available to our employees. And again, when in doubt, please refer to the appropriate labor agreement, or if you need specific questions, we are here through our Employee and Labor Relations Department to assist. But I want to caution you also that mandatory leaves also are leaves that come with stipulations and benefits. In other words, you have to comply with the requirements of the leave in order for you to be deemed eligible for it. So illness leave, you get so many days of leave during the year. They carry over, they roll over. When you run out of it, does it mean that you get another bank? Maybe you do, maybe you don't. So that's where we run into the permissive and optional leaves. FMLA, which we're going to get to in the crux of it. Are you eligible for it? Maybe. Is it required? Absolutely. Under the law, we have to offer it to you. But again, it comes with an eligibility requirement. Bereavement. We are very generous in this organization with our bereavement. In the labor code, under a public education entity, we have certain requirements for which we are required to give it. And sometimes we get a little more here. Maternity and paternity leave, that comes under state requirements, as well as military exigency leave and jury duty. So we draw upon all these, and again, they come with certain criteria for which you must follow. And again, you need to comply with them in the specificity for which you take them. So I want to take an opportunity, folks, to address what FMLA is, okay, and what it is not, how you can take it, and some of the common things that occur with us when these are not followed through in their totality. And Dr. Reed and Lisa can also chime in. But FMLA is the Family Medical Leave Act. It is statutory in nature. California augments it with what is called CIFRA. We are going to talk in big picture under the guise of FMLA. If you have specific questions under CIFRA, we will address it very briefly as well. But nonetheless, there are certain things you need to be aware of because they differ slightly. FMLA is the one the majority of employees in this organization take, and it's one that very quickly can morph into a life of its own if employees are not aware what they can be used for, what they cannot be used for, and what your employer has the right to ask you for in order to ensure that you are in compliance with the elements of the policy. It allows you for up to 12 weeks of unpaid leave, which you can get paid for, but there's some fine print that comes with the ability to use it. It has changed over the years and most recently went through entitlement changes, if I'm not mistaken, around 2017. It is leave to cover either your own serious underlying medical condition, which is why we came after Nicolas, because again, reasonable accommodation addresses issues of serious underlying medical conditions. But nonetheless, it gives you another opportunity to address other compelling circumstances. So for example, the care of a newborn, foster child, placement of an adopted or new family integration and stepchild under the age of 18. So it gives you 12 weeks of leave in order to address the care of these eligible family parties, a spouse with, or a parent with a serious underlying medical condition, or under the recent entitlements, military exigency. So someone is going out on military leave, they can get up to 26 weeks. There are limitations also to the individuals that may be caring for the children of those that are going under military exigency. And these are all statutory requirements that we need to comply with. Now, we want to address the issue of a serious health condition. It is defined. It is not the district making up its own definition. These definitions do fall in the various labor agreements and in our policies. And again, a serious health condition, to augment what Nicolas reiterated, under reasonable accommodation, serious health condition defined under FMLA and CIFRA is a physical or mental condition, pregnancy or prenatal care, which then brings us into pregnancy leave, chronic or serious condition, or multiple medical treatments. Now, here is where it gets tricky. So although these are statutory, you must meet the eligibility requirements. And in the LACCD, you must work for at least 12 months and 1,250 hours during the 12 months prior to the start of the FMLA. Now, that is paid hours of service. That doesn't mean that you're on an unpaid leave for 1,250 hours and think that you're going to come back and roll over and get a new set of FMLA. You must be under paid service in order to be eligible within a 12-month period from the time that you are applying. Now, in California, as I said earlier, you have what is called CIFRA. And CIFRA is, I said, California's own version of FMLA. And again, it is to support the birth or adoption of your own child, or the adoption or a foster placement child. It is for the care of an immediate family member, a spouse, child, or parent with a serious health condition. And when the employee is unable to work because of their own serious health condition. This is also under CIFRA, where your kin care or your parental leave is drawn from. Parental leave is not FMLA. Parental leave is under CIFRA. And that's what makes some of these statutory requirements varied and yet similar. So when in doubt, please refer to your HR guides and your labor agreements to get the clarity that you need, because in these last successor agreements with the various labor groups, we went on ahead and we differentiated what these were, the eligibility requirements, who is entitled to what, and we updated all the definitions of those that are deemed eligible, and we outlined what the certification requirements were. What these serious health conditions are not, okay, please look at the bulleted item. Cosmetic or voluntary cosmetic surgery or treatments are not deemed serious health conditions, okay, unless it is deemed inpatient care. Okay. You do not get FMLA or CIFRA for a routine medical exam. You do not take the day as FMLA to go get your physical annual leave or your PAL. Okay, those are separate leaves that are still available to you on your labor agreement. Okay, liposuction is deemed cosmetic treatment. You do not get to take FMLA. It is not deemed a serious underlying medical condition unless you are now hospitalized because of a complication resulting from it. A Botox treatment is not deemed a serious underlying health condition. And yes, ladies and gentlemen, we have seen certification requests for leave to take care of these particular items. And please be advised that the district is within its right to either ask for clarification or reject it because it does not meet the definition of the leave entitlement. So again, I want to emphasize what a serious health condition is and what it is defined under, why we are at times having employees contact us for clarification, and supervisors, because sometimes we don't hear from employees for a few days, and that triggers other obligations under these leave provisions. A serious health condition is an illness or injury, impairment, physical or mental condition that again involves a period of incapacity for treatment connected to inpatient care. hospital, hospice, or residential medical facility. This period of incapacity is requiring the absence of 3 calendar days from work, school, or other regular daily activities that also involves continuing treatment. So when you are absent from work for 3 consecutive days, we have a trigger for a possible family medical leave related illness. And yes, your as supervisors or as employees may be asked or be provided at that point leave information if it is deemed qualifying event. I'm going to pause here, and I was not sure if Dr. Reed or if Ms. Biggers would like to say a few words.
Thank you. I was wondering if I think it's important. Thank you, Dr. Gutierrez, and hello, everybody. I wanted to emphasize that this kind of goes along with the district requirement of providing a attestation from a licensed medical provider, medical professional for absences. So while this is a serious health condition, which could trigger the this other type of leave, we also want to emphasize that any type of absence that is over 5 days requires a medical attestation, and that might lead into another type of leave of absence. So Dr. Gutierrez, I kind of just wanted to make that clear that we do have district requirements for leaves, whether they're this kind of leave or a regular non-FMLA or CIFRA related leave.
Correct. And we do have our tip sheet and the little grid on what constitutes what a little later on in the presentation on some of the slides, which we will make available to everybody after the presentation. Okay. And Ms. Biggers, I believe you unmuted yourself, but I was not sure if you wanted to say anything.
No, I think you all have done a great job in covering the information, relevant information thus far. Thank you. Hello, everyone.
Okay, so again, we want to emphasize, and this is an updated slide, again, a period of incapacity due to a serious health condition. And some of you started asking Nicolas questions relative to other chronic conditions such as asthma, diabetes, epilepsy. These are considered serious health conditions, and you may be having to go to get treatment with a medical professional, which then triggers your ability to take FMLA in order to receive the medical treatment that you may need. Now, you may have a serious health condition such as asthma, diabetes, or epilepsy that now creates a functional limitation, and you want to have equal opportunity to the work environment, then that could trigger a reasonable accommodation, as Nicolas had indicated prior. So they go hand in hand, but there is a little bit of separating distinction. Again, we want to emphasize that this period of incapacity could be permanent, it could be temporary. Somebody could be in a long-term acute residential facility for 3 months because they had a stroke. They have issues with dementia. They have other diseases, and now they need to take some time off on a consecutive basis in order to seek the treatment that they need for these conditions. Okay. And there could be multiple treatments, again, going back to the cancer example that Nicolas fielded the question on. These could trigger your access to FMLA as a form of reasonable accommodation. If you are seeking treatment, now you need to take appropriate time off work during your scheduled work hours. And so all these conversations happen in tandem at times. And what we run into conflict is when we have this conversation over here, but then we forget to not have this other conversation over here. And then we run afoul into other obligations that we have under statutory requirements. Okay. Now, Ross Lee is not here today, but he would also want us to emphasize that a serious health condition could also be the result of an on-the-job injury or an illness sustained in the course of an on-the-job injury. An example of that could be an exposure into a building that now has, and please don't take this as letter of the law, but now you are exposed to an issue where you were in a building with asbestos and now you have some lung condition. And I'm not saying that our campuses are unsafe. I'm just trying to give you a very clear example. That could trigger a workers' comp claim. It could trigger leave as a form of reasonable accommodation. It could trigger, treatment. It could trigger FMLA as a form of accommodation and a series of other matters. So one of the things that often comes up for us in the arena of human resources, as well as the arena of ODI under reasonable accommodation, is who are these health providers that are providing these notes, who can and who cannot, and what often results in the district having to follow up accordingly. There are very clear definitions under the FMLA as to who is deemed a healthcare provider. And so when we receive certification, we are looking for some of these items in the course of the request for FMLA. So obviously a doctor of medicine, your MD, okay, or osteopathy, podiatrist, dentist, chiropractor, clinical psychologist, optometrist, nurse practitioner, nurse midwife, or a clinical social worker, physical assistant. That is in the definition of who a healthcare provider is. So if you are bringing me a note from somebody that is providing aesthetic treatment and their license is for aesthetic treatment, and you're getting your Botox doctor to tell you that it's okay for you to be off work 3 times a week for 2 hours a day, the district would be within its right to question the note, because again, we have very clear definitions on who are healthcare providers and who can actually certify the medical treatment and certification under FMLA or under reasonable accommodation through the ADA. They must be authorized to practice by the state and performing within the scope of their practice, okay, as defined by state law, or a Christian Science practitioner. So we look for these things because sometimes notes come across our desk by those of you who are asking for clarification. And when we are not finding what is a qualified healthcare provider, the district could indeed ask for further clarification relative to the notes that have been provided. Go ahead, Dr. Reed.
Okay, thank you. Let me try to get my little hand down. Okay.
Okay.
I'm glad we're bringing up this point because there have been occasions where either we cannot, let me just start off with read everything. And so we want to make sure that we're in compliance with all of the regulations. And if we cannot read the medical provider's signature or whomever that professional is, we will come back to, you, the employee, to get verification on that and to authenticate that attestation if there is something that we need to ask a question about. So I just wanted to, emphasize that it is very important that when you give your medical provider these forms, that it is readable and it is something that we can, if we need to, have contact. I see that my colleague wants to add something.
Well,
Lisa?
yes, thank you, Dr. Reed. The only thing I'd like to add is you can see all the information that we're required to deal with when we get a request such as this. That's why it's important that when you submit a request for a leave under what we're talking about today, that you provide us with as much information, very specific information, so that we aren't going back and forth with emails trying to pull information from you so that we can make a decision. The time that we spend doing that oftentimes it may impact you. So if you could just make sure that very upfront, if you can, give us as much information as you possibly can, not necessarily strictly with the doctor including that, but additional information of what it is that you are requesting, and as much details as you can possibly provide. That's it.
So there is a process for which employees must give notice of FMLA. So it's not bring me the note and tomorrow you go on FMLA. There is some professional courtesy that extends both ways in this arena. And based on the provisions under FMLA, you need to give, whenever practicable, a 30-day advance notice to take the leave, which is foreseeable. And that is because, again, you have an entitlement, but it's an entitlement with a condition. Your employer has the right to have coverage for you, to possibly assess whether or not it needs somebody to backfill, depending on how you are taking the leave, whether it needs to be taken on an intermittent basis, and now decisions need to be made that affect the rest of the floor or the department or the unit. Does the work get distributed to other people while you're gone? Is it a consecutive leave? And now we have to put in for a provisional with the Personnel Commission, which, as you know, that would require some time. So 30 days is what the statute actually states. It also has a need for as soon as practicable when it is not foreseeable. And case in point, you have an emergency surgery, you went in for your physical annual exam, and now they found something that needs to come out of you, and it's time sensitive, and now it needs to get done. There are provisions under the law that allow for that component of it. But again, it's not that you come in one day and tell your employer the next day that you're taking this time. And we run into a lot of issues because of this from the employee relations perspective, because it impacts communication, it impacts the operational business needs of the organization, and it doesn't give us sufficient time at times in order to understand what the qualifying reason is, because sometimes again, if we need to do additional follow-up, or you're at the campus and now there's a question on the note, and now your folks at the campuses need to work with our office in employee and labor relations, it creates all these other delays and gaps. So it's always imperative, as Ms. Biggers said, to have sufficient information when you're putting your paperwork in, so that we can alleviate any delays that come in providing you the certification approvals that then subsequently have to be provided to you. Now, there are instances where we run into situations where employees want to take their time as FMLA, and we run into issues. So where the employer was not made aware that an employee was absent for FMLA reasons, and the employee wants the leave counted as FMLA, timely notice must be given so that the leave was taken for an FMLA qualifying reason. And this is where we run into issues regarding abuse of leave. So you took 2 days off because you said you were sick, and maybe you weren't and maybe you were, okay? But then, 5 weeks later, when there's a question in your payroll, you come back and you say, oh, that should have been FMLA. That is a problem. While FMLA is deemed protected leave under the Department of Labor, there needs to be responsibility on everyone's part to ensure that our payroll records and your leave provisions are taken in accordance to the law. So when it comes back to processing your leave, and now there's discrepancies, you create issues where we run into auditing concerns, questions regarding the veracity of the leave, if there are other mitigating circumstances going on relative to job performance. Is it that now there's an evaluation, you took a few days off following the evaluation, which wasn't positive, and now the employee wants to come in and claim the time they were off work as FMLA? There needs to be a little bit of quality control here. Annie and Lisa, before I go on, is there anything else that you would like to add relative to what I just shared?
Mercedes, there is a question, but I'll hold it.
Oh, I'm sorry. I tend to talk and I can't see you want me to take the question now?
Yeah, it came directly to me.
Oh, okay.
And if you like, I can read it.
Sure.
It says, what happens if your supervisor did not get a replacement for the almost 2 months for the person that takes the leave, but gives you the work for that desk and so it's not covered and should be. So basically, what happens for the employee or the rest of the team that has to cover the desk of that person that's out for almost 2 months.
I'm sorry, a vehicle passed by, so I hope I understood the question. What happens if the supervisor didn't redistribute the work for a 2-month period?
Well, didn't get a replacement or is not able to get a replacement for the person taking the leave.
Uh-huh.
And they're out for 2 months.
Well, again, it gets a little tricky to handle case specific questions because anything that I say gets taken as letter of the law, and we may not have sufficient information to answer the question thoroughly. So I would recommend that if there is a concern like that, to reach out to us. But I will say a couple of things. That tells me a few things. There could either be the request came in late, okay, which again begs the question of communication and operational business need. It could be that there wasn't enough time to work with the Personnel Commission, or and here's what I mean about timely filing. If your leave is not coded in the system and the Personnel Commission does not see the leave entered in the payroll system, most likely, okay, based on the preponderance, more likely than not, you would not be allowed to get a provisional because we don't have leave paperwork entered into the information system. That's one thing. And we don't know what we don't know based on the limited context of the question. The other thing could be, perhaps there was an interest in providing a cost savings and a determination was made not to backfill. Those are things that are very, very specific. Those are all scenarios that I have helped dealt with in the time that I've been here. It could be that the person just let it lapse and didn't think they needed one. There's several innuendos here. Can a person put in for provisional if the paperwork is filed timely and there's enough time to plan? Absolutely. Whether or not things were done in a timely manner, I don't know.
Okay, there is another question real quickly.
And I see a hand up too.
Okay, is an extended medical leave under accrued sick leave if, for example, somebody has 100 sick days under FMLA, or is it just standard sick leave that needs a return to work medical verification?
Okay. So FMLA, and I'm going to address that a little later on, but we'll just kind of front load it. FMLA does not have 100 days. And this is what I mean. We have all these regulatory requirements. The 100 days is one provision of the education code. FMLA, by definition, under the 12 weeks would be the equivalent of 60 work days. That's 60 work days of eligible paid leave if the individual has paid leave on the books at either full pay or half pay. That's where the 100 days comes in, right? But that's the person can ask. It's unpaid leave. If you want to get paid for it, it comes out of your own pot of money. There is no special pot of FMLA designated leave that is above and beyond what our statutes require us to provide you under mandatory illness leave in the education code.
Thank you.
Okay. And then I see a hand up. Let me take the hand and then I'll continue.
Yes, hello, my name is Miguel, and thanks a lot, Dr. Gutierrez, for his presentation. But there's two things. I actually have a lot of questions. One is a whole issue about communication. One thing is, it would be a good thing to better the communication if the Human Resources Department would actually have that information on the website. Second thing is the issue about replacing employees. That doesn't seem to be much of a concern for the district, as we've seen it in a lot of offices. They with years and years and they don't replace people. So I don't think that really goes into effect. But generally, where are those forms at? When the 1,250 hours, where are those forms located? The other thing is how many times do you have to do the FMLA? When do those 1,250 hours reset?
Okay, so those are all questions that will be answered as we go further along. So let's keep going along. I actually have slides for all of that. Okay.
Thank you.
All right. So let's talk a little bit about what happens under a leave exhaustion. And then we'll go into some of these other questions that just came up. So exhaustion of family medical leave, 1,250 hours in a 12-month period is the eligibility requirement. In LACCD, that is an eligibility cycle of January to December. That is how this district has chosen to do it. That is how it's outlined in the labor agreements. That said, there's another way of calculating the 1,250 hours requirement from the day that you ask for the leave. The district does not do that here. And again, 1,250 hours from January to December, 12-month calendar period. Okay. Now, once that leave, your 12 weeks at 60 days exhausts, if you met the paid service requirement of 1,250 hours, then you roll over into the next year, you are deemed eligible for FMLA again. And I say that because you had to have been paid in order to meet the 1,250 hour requirement. Okay. Now, what happens when you exhaust your eligibility? And we have employees that exhaust it. Now, as I said, these labor agreements have a lot of flexibility. You have certain rights that other organizations do not give. Okay, there's certain things that leave you on hold, but our obligations under FMLA are very clear. So when you exhaust your right to FMLA, and let's say you took it consecutively, because right now I'm only talking about you taking it all in one swoop. Okay, we're going to talk about the other one that causes me more problems. But employees who have exhausted their FMLA, they've exhausted the 12 weeks, and let's just say there's nothing else for them to use, they need to come back. Okay, they have lost all job protections under FMLA as a protected leave. Under FMLA, you have the right to take the time off, either for yourself or those who meet the definition, and your job is protected. When you run out of time, it is no longer protected leave, which then means the other attendance requirements fall into play. And if employees don't follow the attendance reporting procedures, then that becomes an attendance issue that is not protected under FMLA. And I'm speaking in very broad strokes so that we can cover the information. Once you've exhausted your leave, it is no longer protected leave. All leave by definition can be deemed protected, but you must meet the conditions of the leave for it to be protected. If not, it's not protected. So if you tell me that you were on FMLA and then you came back for a day and then you slipped and fell and now put in for a workers' comp leave, that's a different leave with its own conditions. And let's say you ran out of that one and then you ran out of this one, then there's no more protection. Or you took all this leave, this illness leave, but you never told anybody. And now you have to get the attendance letter that says, we don't have any ACRs on you. If we don't hear from you, this is all unpaid leave. Leaves come with conditions. You must meet the stipulation of the condition to be eligible for the leave. Okay. So FMLA can be taken two ways. Concurrent means you take it all, the 12 weeks as a whole, which is the equivalent of 60 work days or 480 hours, or you can take it on an intermittent basis. That means hour here, 2 hours there, 3 hours here, which is how a lot of folks tend to take leave, because they have to care for the parent that may need to go get therapy following a stroke, and now they've got to go to the physical therapist 3 hours, 1 day a week. Okay. It is imperative here that people stay on top of how they're turning in and claiming their time, because there is a certification requirement. If the doctor, again, going back to that qualified medical provider, based on the definition, says, that this leave is for 2 days a week at 6 hours a week total, 4 times a month, well, then that's the requirement. Okay. And it's gotten as far as the provider needs to actually articulate which days they can be. That's on the medical certification. Here's what happens. People take the intermittent leave because it's approved, but then they don't follow the stipulation of the leave. And that is a problem. That's not protected leave. So if your doctor says Monday, Wednesday, Friday from 2 to 5, it's Monday, Wednesday, Friday from 2 to 5, not Monday through Friday from 1 to 4. It is Monday, Wednesday, Friday from 2 to 5. And if a supervisor reaches out and says, hey, I keep getting this recurring issue, can you please review it? That has opened the door for our office to follow up either with a letter with the employee or follow up with the medical provider to clarify the certification. And again, intermittent leave is merely that. It is 60 days spread out over however it is to become the equivalent of 12 weeks, 60 work days, or 480 hours. And if you exhaust those times, it is no longer protected leave. So we have folks that for one reason or another put in their intermittent leave, don't follow the certification requirements. Now they have a problem and they either exhausted it because they took off consecutively, which is not in accordance to the certification requirements. And at that point, Human Resources does have a right to follow up with the employee and say, hey, it has been brought to our attention that your FMLA is not taken in accordance to how you agreed to take it when your doctor signed off. You either need to give us a new one or follow the one that your provider has sent you. And here's the thing, they need to update it every time they're asking for it, not just copying and pasting the old form over and over again, because we can tell, and make sure that it is updated accordingly. And if there's ever a problem and we can't tell, we're going to follow up. And I will give you a case in point. We had a note that was reasonably suspicious at best. And when Ms. Biggers followed up, it was not an accurate form and we had to follow up with discipline. So these are all legal documents. If folks say they're going to take it a certain way, they need to follow it, okay? There's this thing called flare-ups. And while we have no control over a flare-up, if your certification says 2 hours a week and you had 4 flare-ups at 8 hours, you're out of compliance with how you asked for your certification to be taken as intermittent leave. So I think I've covered this slide, but I want to be clear in case I haven't. Okay, FMLA and sick leave. Remember, the law says FMLA is an unpaid leave. You can use your sick leave that you have available for you in order for you to get paid. Okay, you can use other paid leave available to you, like vacation in lieu of sick. Whatever pot you have in your own quota bank is your pot to take FMLA if you would like to be paid for it. Okay. If not, then it's unpaid, and people need to be conscious of that. We can only protect it if we know that it is FMLA. Otherwise, if it's regular sick leave, it's regular sick leave. But only you know what you are asking for. But sick leave and FMLA are not the same thing. So when somebody says, oh, I was out on FMLA and there's no paperwork because you put in an ACR that said you were sick and then you checked off FMLA, that's not protected leave. You must have certification on file with your campus and ultimately with Human Resources, okay? This creates a lot of issues where labor and management have to have certain conversations because it doesn't impede absenteeism, it doesn't prevent tardiness, You know, it's not a means to stop work productivity. And these are issues we run into when we have protected leave that becomes questionable. Okay. Now, if there is an attendance issue, because it's FMLA, we tell our managers stand down and back off if the paperwork is in accordance. But if it's not in accordance, we have to work on ensuring that the paperwork is proper, because, you know, protections go both ways for the employee as well as the employer. Now, let's say that the employee has taken their FMLA, they're ready to come back to work. They have to come back to the same job that they took the leave for. This is not a means to eliminate positions. If a person's position is eliminated while they are out on a protected leave, that is a problem. And I will tell you that HR will go and tell the manager, you cannot do that. And we have already in a few instances. Somebody coming back from FMLA may require reasonable accommodation, which then triggers B32. Okay, sometimes the B32 triggers the FMLA. So these are all conversations that happen in multiple modalities. And again, we want to remind you to please refer to the appropriate labor agreement that you may belong to if you're a representative employee, because everything tends to be spelled out there. We still have one labor agreement that we've not settled with, but nonetheless, we are required to follow existing FMLA language, whether it is written in a labor agreement or not. How do you apply for FMLA? Okay. Okay. So in the PowerPoint presentation, these are live links, and they will actually take you to the leave of absence. So under our HRP 400A HR guide, we do have the actual processes written out. Okay. It is a downloadable PDF, but you have to apply for a leave of absence, and it's a separate form. You do have to have your FMLA certification. At FMLA, I also have it linked. If you have any problems and it's not linked, you can always email us, but the FMLA certification is regulated by the feds, so it's not us making up a form. So there is a downloadable form that employees have to take, and there needs to be at least enough time to go get the paperwork done. So remember what I said, timely notice. Make sure you have enough time to get to that doctor from the time you need to take the leave, so that there's enough time to process it. And as you all know, this is a very large organization where things very quickly fall through the cracks when we don't have things in on time. And even if on time, we're still a large bureaucratic organization, but having it is better than nothing. Okay. All right. So you need to make sure your certification and your leave of absence request are turned in together. This prevents delays. Okay. Make sure that you have the appropriate proofs of relationships. All of that is spelled out, and it's written out in the certification and in the leave of absence form. So we have a tip sheet available for you. Looks like this. It is available on the HR website, okay, under tip sheets, and it will actually give you, there we go, what constitutes a formal leave, what constitutes an informal leave. If you download it from the website, it actually has the forms hyperlinked. Okay, ACRs in and of themselves, when you need the supplemental doctor's note for absences 5 days or more. If you're going to be absent 21 days or more, you need to have an actual leave request on file. Okay. And that's a sample of the physician statement. Okay. Now, folks, this is what I mean. Please make sure that and please make, I'm just caution everybody, please make sure whether it is you or the employee you are supervising or the employee you are representing is fully aware that these forms are legal documents. So when they are copying and pasting over an old form and they are careless, they are creating an HR issue for themselves, yourself, or the person you're representing. And I will tell you that we had a very sloppy one that was turned in over the summer that resulted in a dismissal. So this is something that we take very serious in the organization. These are documents that are supposed to protect you. They're supposed to protect the organization. So if they're not authenticated and we find there's a problem, we go in and we follow up accordingly. So just showing you a sample. Yes, Ms. Bickers.
I'd like to add that authentication involves, sometimes when you send us these documents, you're sending them via email. Of course, that's a PDF format. So that basically means that you are still in possession of the actual original, and we will come back and request you to ask you to provide us with that particular original document. So make sure you hold on to them, because if we can't get them, we're going to assume that perhaps they were never submitted appropriately.
And here's the fine print on that leave of absence form, okay? If a person is taking a leave and they've written dates, and maybe they forgot when they were copying the note over, okay? And they agreed to come back by a certain date, that is a bona fide screenshot of the form. Failure to return to work upon expiration of a leave of absence may be considered abandonment of position, which, as you know, is a different conversation and a different letter that has to come out of the campuses and ultimately human resources. So, you know, these leaves, although protected, they come with protections and conditions. If you do not agree to the condition that you yourself may be stipulating to, or your doctor stipulates to, you place yourself or the people you supervise or whomever into a position where the district can effectively deem you having abandoned your position. Lisa?
Yeah, that's why it's important. Sometimes you'll receive communications from someone when it gets closer to you to return from your leave. If we communicate, reach out to you, and you're on the borderline of exhausting that leave, and we don't hear from you, we are having this AWOL conversation because we don't know. If we don't hear from you, we're going to assume that you're abandoning your job. So it's important that you respond to whatever communications we put out to you. Thank you.
Yeah. All right. I got 2 more slides. Okay. Workers' comp, we want to cover it very quickly. Obviously, if someone has claimed that they have an on-the-job injury, they need to file their workers' comp claim, okay? Once it is claimed, okay, the time can be coded as industrial accident paid. However, here's the part that makes everybody mad, okay? When a person is off on industrial accident, whether it is paid or unpaid, okay, nobody gets their quota bank back until the claim is accepted. So if you're going to be off on a workers' comp claim type of leave, it's coming out of your own quota until the claim is accepted, at which time you get all your time back. But until then, it's your time. And some folks will run into unpaid status. And that's where the 100 days comes in, right? We all get that little bank off of the education code that says we can get up to 100 days of illness leave. But that covers full pay and half pay. If you're completely out of any leave, folks, and you're in unpaid status, that affects your service credits, it affects your health benefits. So you need to be very careful about how you're taking your time, especially when you're in a workers' comp claim, because I once had to deal with seniority in a layoff, not in this organization, but they were in an unpaid leave, and that affected their seniority service credits towards seniority, and they were subsequently laid off, not for having been on workers' comp or a workers' comp leave, but because they ended up being the least senior on the seniority list because they weren't accruing service credits. So it's imperative that however the time is being taken accordingly, and that it is recorded properly for everybody's interest. An employee can file for FMLA if they're on a workers' comp leave, and they can ask for reasonable accommodation if the individual is ultimately found to come back to work with permanent and stationary requirements that trigger the interactive process. But eventually, once a claim is accepted, they get their time coded as paid industrial accident, and folks get their time back. And I say this because all these leaves are intertwined if you go back to my original slide, because they're all same little pots of paid time, and eventually we either give you your time back or you just keep losing time. So it's a team effort here, folks. So I'm going to stop here.
Okay.
And maybe
Ms.
not, because because when sorry, last slide, I was a little too eager there. Okay, so when you exhaust all your leaves, you get a leave exhaustion letter from the employee relations office, and here's some things that happen. You run out of time, all paid time, unpaid time, all these generous unpaid leaves that we give you in this district. Eventually, if you don't come back, we either have to treat you as abandonment, or we have a right to file a PERS related retirement if you're classified, or if you're certificated, you can retire through your appropriate retirement system. You can resign or apply for an unpaid leave. So I will stop there.
Okay, thank you.
Okay.
There was one question I sent to you in the chat. When employees have many illnesses and absences, whose responsibility is it to check if it is legit or qualifies for FMLA? Supervisor, personnel on campus, HR at district?
All of the above.
Okay.
I believe I said it's a team effort here. And when in doubt, you know, and that's the complicated part about leaves, because this is a big organization. I came from an organization that had 4,000 employees, and you know, we had different consolidation of programs and services because we're in a decentralized model. By the time it comes to HR, months have gone by, the damage is done, they're crying for help, because to Miguel's point, you know, nobody ever got a provisional because nobody ever told the PC they wanted a provisional, but then the FMLA wasn't recorded into the payroll system. So then HR is like, well, there's no leave in the computer system, so how can we help you get a provisional if there's no leave? This is a full team effort. And so unfortunately, too many years have gone by with people being very decentralized. And unless people actually start to talk, you know, it makes it very challenging to help. But yes, it starts with the supervisor. If they haven't heard from the employee, you know, they need to go to the administration at the campus. Administration at the campus can go and call us. Sometimes I have supervisors that reach out to us directly, whether they're, you know, they're the registrar at ELAC, to the dean of a program. You know, I don't hear from any faculty chairs. Usually I'll hear from a dean or a supervisor. And then, you know, from there, it's a little bit of detective work, and we end up working, you know, with payroll. We end up working with Annie and Lisa, and sometimes we all touch it. Sometimes one of us touches it, but it's everybody. Everybody needs to do their part.
Okay. Well, I do not see any further questions. This has been very thorough, and the examples have been perfect to really dig down into what's needed to request a leave, and the whole protocol around FMLA that has been so confusing over the years to so many managers, supervisors, and the employees. So thank you so much, Annie, Dr. Gutierrez, as well as Lisa, Dr. Biggers. Thank you all. This has been so eye-opening, so many new things that I have heard that was not told to me when I was actually taking FMLA leave over a 10-year period. But yes, a lot of wisdom, and we really appreciate this. I see thumbs up for you both.
Thank you. Thank you.
For all three of you, actually. Great information. And so with that, everyone, we're going to now close out, and thank you for attending.